Okay, I'd like to welcome everybody to the Manchester Safeguarding Partnership Neglect Toolkit introduction video. The creation of this presentation has been supported from agencies across the Manchester safeguarding system, and it does demonstrate how agencies can all work together to address child and adult neglect in our system. The presentation will be provided by myself. I'm Claire Sedgley and I work for NHS Greater Manchester ICB. I've also got Alex Jones on from Manchester Children's Social Care, Danielle Comerford from Manchester Adult Social Care. We've got Ed Haygarth from Manchester Education and Jacqueline Smith from Manchester Foundation Trust. And you'll hear from all of us throughout the presentation. The agenda for this short introductory video is we are going to touch on what do we mean by child neglect, what do we mean by adult neglect. It isn't neglect training per se, but we are going to touch on what we mean by those terms. We're going to look at the prevalence of neglect at a national level and at a locality level. Why is neglect a priority for Manchester Safeguarding Partnership? And we're going to look at the Manchester response to neglect, where we're going to look at what tools we've got to help you when we're looking at children's neglect, adults neglect, and also all age, because we know neglect can happen at any stage of life. So child neglect, I'm going to pass you over to Alex, who's going to help lead us through these first few slides. Thanks, Alex.
So childhood neglect is the most common reason for children to be subject to a child protection plan. In our city, Manchester, 48% of children on a child protection plan is due to neglect, and we even see the impact of neglect with the proportion of children who enter our care as a result of that. We see childhood neglect feature in 60% of child safeguarding practice reviews, and it is the most prevalent form of child maltreatment in the UK. Whilst we often think about neglect at the point of presentation, it's also important to remember that neglect can have a long-lasting impact on a child through into adulthood. And we see evidence of that with adults through compromised mental health, or maybe using substances as a response to that early childhood neglect. We also continue to see increasing evidence in research around adverse childhood experiences, and that again demonstrates the potential for developmental trauma, and in turn may lead to lifelong lasting impacts of neglect into adulthood.
There are different features associated with neglect. For instance, education, where the child is not taken to school and fails to support the child's learning needs and stimulation at home. Emotional neglect, where parents may not be responsive to the child's needs. This can hinder the child's emotional self-esteem and ability to form positive relationships for themselves. Emotional neglect can also affect the child's ability to interact with others. There's medical neglect. The parents may fail to take the child to health appointments. This can lead to health issues not being resolved, which can have a long-term effect on the child's health and well-being. The parent may also minimise children's health and not seek the correct support that's required. Physical, this is where the parents are not providing appropriate living conditions, poor home conditions, clothing, presentation of the child, including hygiene. There's also supervisory, which is supervision parents to provide safety for the child at home. Whilst these are categories of neglect, it's important to recognise that the experience and impact on the children at different stages of their life. As you can see, at every stage of the child's life, neglect will have a significant effect on the child as they grow and develop. As seen on the slides, there are many aspects to neglect, from pregnancy to adulthood. In each stage of their life, it is crucial for children to have adequate medical, nutritional, emotional, educational, physical and supervision to thrive. It is important for each category seen on the slide to be provided as services as correct assessment and support needed.
Okay, so moving on to adult self-neglect. The Care Act 2014 defines self-neglect as a wide range of behaviour neglecting to care for one's personal hygiene, health or surroundings, and includes behaviour such as hoarding. This slide details some examples of the signs of self-neglect alongside some of the causes and contributing factors. Remembering that self-neglect is a form of abuse recognised in the Care Act, a safeguarding response may be required in certain situations. So self-neglect, which is causing a person harm, for example, when a person is not seeking medical attention or not accepting a care package, which results in a deterioration in their physical condition or an exacerbation of their social care needs, are some examples of circumstances where a safeguard adult referral should be made. The referral will enable adult social care and partner agencies the opportunity to gather and share relevant information, aiming to create a full picture of the person's situation and their identified risks. Reflecting on the people that we work with in our professional capacity, how many people have demonstrated some of these signs of self-neglect? Have there been occasions where we've been unsure where to refer the person to or what actions are needed? We are hoping that the All Age Neglect Awareness Tool and Supporting Guidance document will help us as a partnership to confidently identify and respond to self-neglect in these situations. We will talk about this tool a little later on in the presentation. So adult self-neglect. Adult self-neglect is the most common reason for a safeguarding adult review. These are also known as SARS. So self-neglect features in over 60% of SARS. A national analysis of SARS carried out in 2020 and 2024 identified themes across SAR recommendations within these cases. One of the themes noted was improved multi-agency working and information sharing. So thinking about our response to self-neglect cases, how can we work together more effectively as a partnership? Utilise multidisciplinary team meetings, safeguarding planning meetings, for example, to bring services together. Utilise and maximise the strength of one another's services and resources. Collaborate with one another to build and create robust support plans or safeguarding plans, which delegate and designate lead professionals to identified actions or intervention. Another theme was improved mental capacity assessments. How often do we consider utilising the Mental Capacity Act in these cases? Are we considering executive function within our capacity assessments? Executive function has been described as the ability to think, act and solve problems, including the functions of the brain which help us to learn new information, remember and retrieve the information we've learned in the past, and use this information to solve problems of everyday life. The absence of such functioning is where a person, for example, in hoarding cases, gives what appears to be coherent answers to the questions, but it's clear from their actions that they're unable to put into effect the intentions expressed in those answers. So colloquially, this could mean or describe the person as being able to talk the talk but unable to walk the walk. Furthermore, in some neglect cases, the assumption or use of the term lifestyle choice has been highlighted as a barrier to intervention, prohibiting access to services for those who are eligible for support. As practitioners, it's really important that we utilise our professional curiosity, as in most neglect cases, it's not the person's true choice to live this way. Section 4 of the MSP self-neglect guidance focuses upon mental capacity and executive functioning, and Appendix 7 of the guidance is a really helpful mental capacity tool. When responding to cases of neglect, it's imperative that we remember to see the person in their entirety and keep them at the heart of what we do. Concerns around neglect shouldn't be responded to in isolation. So this slide is a case study for Mr. A. So we believe that Mr. A's circumstances are similar to cases which we all encounter across our services. And what we'd like from practitioners is to utilise this case study to aid reflective discussions within our teams. The questions on this slide have been designed to aid and promote professional reflection and curiosity. Some of the key topics that we'd like you to think about are the potential connections between neglect and other challenges that people may be experiencing within their lives, such as the impacts of substance misuse or trauma. Moving toward Manchester becoming a trauma-informed city, how do we utilise a trauma-informed approach which enables and empowers people to engage with services? Is there a risk of unconscious bias impacting upon our professional decision-making? These are just a few points that I really like us to think about. Looking at Mr. A's case through a much broader lens, within our practice, are we utilising a think family approach? Does Mr. A's brother require support for his well-being, which will enable him to fulfil his caring role? What's the impact of neglect on Mr. A's wider support network? And what services can we offer to support Mr. A and his family? which maximises their strengths, aiming to achieve better outcomes for all together.
Thanks, Danielle. So we've now heard from Alex and Jacqueline looking at childhood neglect and a prevalence of that in Manchester and on a national level. And we've heard from Danielle looking at adult neglect and adult self-neglect, how we can identify that. And actually, it is a form of abuse under the Care Act. So with all of that in mind, Manchester Safeguarding Partnership has got neglect as their top priority. It's part of our strategic plan. And this is why it is our top priority, and this is why as a system we've come together to create the tools, create neglect in Manchester. We're going to have a little look now at the children's reviews and adults reviews which have taken place, which specific for neglect. So when there has been a death or significant abuse and neglect has occurred for a child or adult, and it's felt that the multi-agency partnership could have worked better together, then a statutory review is carried out. For children, this is a child safeguarding practice review or a CSPR. For adults, as Daniela said, it's a safeguarding adults review or SAR. In Manchester, as you can see, we have a high number of reviews which include the theme of neglect or self-neglect and including Mental Capacity Act. So this is a priority which is very much specific to Manchester, which is why we need everybody to sort of pull together and look at how we can address it as a system. And our hopes are that with use of the Graded Care Profile 2 neglect tool for children, with use of the all age neglect tool for children and adults, with our self-neglect guidance, which is already on the MSP website, our hope is that with these tools and with the education that we have in our agencies, that we can actually help to work together to reduce the number of these reviews from taking place, because we're going to be getting in there earlier. We're going to notice neglect for a child and adult at an earlier point, get the right support in early, and hopefully reduce the numbers of reviews which we have to do in Manchester. This is why we need neglect champions. So we have I think it's 140 neglect champions in the Manchester system from all different agencies. So if you listen to this presentation and you are one of our neglect champions, thank you very much. It helps us with our multi-agency response. The neglect champions help us to get the messages out there into our agencies. Now we've had a look at neglect, we've had a look at prevalence, why it's a priority. We're now going to have a look at the MSP Neglect Toolkit and how this has been created to help you. There's been a massive call to arms over the last 12 to 18 months in Manchester to look at the system response to neglect. And this has been done in three-pronged really. So children's approach, adults approach, and actually an all-age approach. We've pulled it together. Children's, Alex is going to have a talk through in a moment. We're going to look at the children neglect strategy, the Graded Care Profile 2 neglect tool. Adults, we're going to have a look at the self-neglect toolkit, which is already on the website. That's been out since 2022. Adult neglect strategy, that's coming out this year. It's just in final draft form. And all age, we've now got our all age neglect awareness tool and guidance document. We've got the multi-agency training offer which MSP provide on children's and adults neglect, and we've got our neglect champions. So that's our toolkit. We've got children and adult strategies, we've got neglect assessment tools for both, and we've got training as well to help sort of strengthen that toolkit. So we're going to have a look at some of these in more detail. Alex, can I pass over to you to have a look at the children's? Thank you.
Hi everyone. So we've got our childhood neglect strategy, and that was developed 2021. And we're currently in the process of refreshing that, so it'll capture all the things we've spoken about today and really focus on our the rights of the child and our ambition to become a child-friendly city, and how we support children thrive within the context of neglect. In terms of the priorities of our strategy, it's that real strategic commitment across the Safeguarding Partnership to address neglect. And the Safeguarding Partnership is everyone. It's not just those, core agencies that we see. It's safeguarding is everybody's business. So if you're coming into contact with our children, families or citizens, it's about really thinking about neglect and how you recognise and then respond to it. The second priority is all our safeguarding partners to be equipped to recognise and respond to neglect, as I've just said, and then how we prevent neglect and respond at that earliest opportunity. We all know that early identification and getting the right help at the right time has the greatest impact for children and families. And as a multi-agency partnership, we want to be able to evaluate our practice, continually improve so we continue to become more effective and reduce the prevalence of neglect for children in our city. Okay, so one of our big strategic responses to supporting professionals to be able to identify neglect is we have decided as a partnership that the Graded Care Profile 2 tool is the tool that we'll be using to assess children's experience of neglect. Now, this is an evidence-based tool, so it's a tool that as frontline practitioners we can use to really understand and assess the impact of neglect on children. The training has started to be rolled out since last year for frontline practitioners across the partnership, and the MSP will continue to offer training 3 times a year. So if you haven't been accessed that training, please do. And if you have accessed the training, let's all start to use the tool. It's important that we use the tool, not just access the training. The objective of the Graded Care Profile 2 training is really building on the strengths, the evidence-based assessment to measure the standard of care that's provided by carers or guardians to the child, and it's based on Maslow's hierarchy of needs. So it doesn't assess the reason for neglect, so it's important that this sits alongside any other core assessments that you may do as an agency, but it helps you as a professional identify strengths as well as areas of concern in relation to neglect. The tool will help you capture levels of need in relation to physical, emotional care through a graded scale. 1 means always met and 5 is never met. So you can gather that information going through the tool and find information that supports your decision making and also directs the areas of most concern and where you're going to target your interventions. The assessment tool can be used to assist professionals work, provide guidance, interventions and or signpost and refer to other agencies. And it's a tool that is used most effectively when it's used with our parents and carers and with the multidisciplinary team that's supporting families. As a partnership of professionals, we all see different aspects of care that our children are afforded, and it's how we bring that together to create that shared understanding of neglect and the level of need. But it also will help us as a partnership build a shared language and improve our decision making about when we may need to provide more support or provide greater support at a higher threshold of need. Just in terms of when we're using the assessment tool, we just think it's important to remember it, we can do it with our parents and carers, and also to use existing team around the family meetings or our core groups to use that time to do that tool together. I know when you may have done the training or when you think about the training, there can be an anxiety about how as one professional you're going to do all this. It can be time intensive, but think about how you can use those professional meetings to pull all partners together to get that real insight, so we can make the best decisions about how we support children and families.
Okay, so just having a look at the adult self-neglect and hoarding guidance. I have referenced it in the previous slides, and it can be found on the Manchester Safeguarding Partnership website, but I just wanted us to take a closer look at how this guidance can support practitioners to effectively respond to neglect. So the guidance aims to provide an understanding of self-neglect in the context of safeguarding adults to aid a proportionate response in accordance with the Care Act 2014. It also utilises a RAG rating system to help identify levels of concerns and possible actions, and this coincides and aligns with the All Age Neglect Awareness tool. Furthermore, there's lots of helpful information in this guidance, specifically guidance that examines the interface between the Mental Capacity Act and adults who self-neglect, and how we can effectively explore and assess executive functioning. And finally, the guidance appendices also has lots of tangible tools for practitioners to utilise. So, for example, there's tools for case supervision, the clutter image rating scale, for hoarding cases, and an overview of the legal frameworks that are available to all of us as practitioners, plus many, many more helpful resources.
Thanks, Alex and Danielle. So we've heard from Alex looking at the children-specific tools. So we've got the children's strategy, and we've got the graded care profile too. We've heard from Danielle about the adult-specific self-neglect and hoarding guidance, which is already on the MSP website. So we're going to have a look now at the all-age tools that we've got to help our practitioners. So the all-age neglect tool is brand new. It's been created by the multi-agency partnership. It isn't an extra document for you to fill in. It is there should you require that support. So you could use it as a reflective tool in supervision. You could use it with the citizen who you are supporting. You could use it as a handy signposting tool. It can be moulded as to how best to fit in with your role and your agency. It's a way of strengthening the evidence of your concerns around neglect and will help you identify what onwards referrals you need to do. It can be used by all agencies in Manchester. You don't need any specialist training for it. What I will say is, as an agency, you can decide how this can best fit in with your work with our citizens of Manchester. So whether that be education, district nurses, probation, housing, this will hopefully help you to highlight your concerns and what you need to do about them. The RAG rating on it matches the RAG rating in the self-neglect guidance, and the domains, we have used the domains from the Graded Care Profile 2 document, but we've also added in some extra because this document covers adults as well as children. So it matches the children's domains from Graded Care Profile 2 with some added extras for adults. It can be used for any age group. What I will say is, if you already suspect a child is being neglected, then you would refer for completion of the Graded Care Profile 2. We're not asking you to duplicate your work. But if you're not sure, if you just need something to help gather your thoughts and actually what do you need to do, this tool is going to be there to help signpost you. As well as the tool, we've also got a guidance document which we have created to help support use of the tool. It's only 2 pages. We've just got here the diagram which will help demonstrate at what point the tool can be used, where it fits into the system. It may lead to a referral for a Graded Care Profile 2 tool if it's a child that's been neglected. It may lead to a referral into early help for children or for adults. It may lead to a safeguarding referral to Manchester Contact Centre. What it will do is help you decide what needs to be done. And also what it will do is help you identify neglect at an earlier point and actually what actions need to happen then, so that we don't need to get to that safeguarding point at the end. We're trying to get in there earlier. All of these are available on the MSP website. Okay, we're now going to, what I've asked Ed, who is our educational representative, is to come and just provide an example as to how the all age neglect tool can be used by any of our agencies in Manchester and tailored to fit your needs. So Ed, over to you.
Thanks, Claire. So I'm Ed. I am the lead for attendance in the city, and I'm really happy to be involved in the recording today. And just to provide a little bit of an example of perhaps where you as a school or an education setting, or any other setting for that matter, might be able to use the all age neglect tool for specific reasons. And I have many conversations about attendance and education being a first sign of neglect. And I think it's really, really important to recognise that attendance can often be a first indicator of something that isn't right at home. Children very rarely just stop attending school for no reason at all. There is often many other things that are going on behind the scenes. However, attendance in itself or absence in itself is not education neglect. There'll be a number of other things going on, and I'd really strongly encourage anybody in school to use the all age neglect tool to identify some of these other aspects that are going on. And it can be used for the pupil that's in the school, it could be used for the parent at home as well, because we often know that adult mental health is often a reason for some of those absences at school as well. So other things to consider and things that you might want to record within your all age neglect tool when you're doing it is what is going on at home. So have you spoken to the family and have you worked in partnership with them to tackle that absence? So in short, have you used your graduated approach to attendance? Have you used your initial letters? Have you done home visits? Have you tried to engage the family in a parenting contract or perhaps even an early help assessment? If some of those things haven't worked and they haven't engaged with that support, that will raise some concerns for you as well. So is that young person's outcomes being impacted by their absence in school? So are they about to sit their SATs? Are they about to sit their GCSEs or their MVQs or any other qualifications? And is that neglect or that suspicion around neglect impacting their positive outcomes in the future? I think the other thing to think about, particularly when you're in school, is some of those other measures as well, some of those tougher measures that we know that we can do. So have you talked to the family about penalty notices and prosecutions? Have you actually had penalty notices and prosecutions? They're still not making a difference. 6 months down the line, they are still not attending school. That is a really clear sign that actually the family are neglecting those individuals. Are there further concerns during home visits? We're all expected to do those home visits, perhaps weekly if they've not been attending school. Are there actually further concerns when you're doing those home visits? And are there other vulnerable adults within the household as well? We're seeing so many signs that actually adult mental health is impacting on those pupils' attendance at school. Now, all of this can be captured in that all age neglect tool. So as we saw on slide 17, it's a really good tool to rag rate some of the concerns that you've got, to highlight some of the support that you've put in place, and really just to kind of capture everything that you're concerned about around education neglect. And as I was saying, that we often know that education neglect can often be a lack of attendance at school and school absence. So the expectation isn't that all schools will be doing that graded care profile, but we are expecting schools to be using that all age neglect tool to evidence some of the work that you want to maybe take to advice and guidance, but also just as a tool for yourselves internally to be capturing some of the work that you've done around neglect and capturing some of the concerns that you've got.
Thanks, Ed. That's great. And if we think about how Ed's described how education is going to use that all age tool, so that information gathering, looking at the wider aspects, what else is going on for this person, for this child, this adult, those key points that Ed's raised, all agencies can apply that, and on how you can use the all age neglect tool just to help with those early concerns, and how as a system we pull together. So thanks very much, Ed. I just want to finish off having a look at our neglect champions. And as I mentioned before, we've got at the minute 141 in Manchester. Now, your agency will have a neglect champion. We tried to make sure that all agencies had a selection. Their role is to help advise and support their colleagues within their agency. If it's a children's agency, it's helping with the graded care profile 2 tools. We have neglect champion training days, so we help give them the information, make sure they've got everything they need for the champions to then disseminate that across the system. If you've got issues with using the all age tool or the graded care profile 2 tool, as well as raising that within your agencies, you may want to have a conversation with your neglect champion. They may be able to answer your query. If not, they can feed that back to the neglect subgroup, and we can again look at the gap in the system, and we can help fix that and see how we can support. So key points to remember, or take home messages from this presentation: neglect is a Manchester priority. It is very specific to our locality. We need to pull together as a system to address it. We need to be recognising neglect earlier, so that we can support children and adults sooner, hopefully preventing that escalation into safeguarding. Utilise the neglect toolkit, the all age neglect toolkit for children and adults on the MSP website. Use the graded care profile 2 and the all age neglect tool to help gather that evidence and decision making and what actions we need to take. And as a reminder, it is the responsibility of all of our agencies in Manchester to recognise concerns about neglect and refer on to relevant agencies. So we're not asking you as individuals to be everything for that person, but what we are asking you to be is somebody that identifies neglect and knows where to refer that on to and knows what action to take. Neglect can happen at any age, so it's about thinking family, thinking of those wider aspects. We hope the toolkit will be useful for you. Please feed back to us. It's going to be a rolling process, so everything's on the website. And really, thanks ever so much for listening to our video today. So thank you.